This spray is used on the skin to relieve itching and pain from skin conditions like scrapes, minor burns, eczema, and insect bites. It can also treat minor discomfort and itching caused by hemorrhoids and certain other problems of the genital/anal area, such as anal fissures and itching around the vagina/rectum. In addition, it can decrease discomfort or pain during certain medical procedures/exams, such as sigmoidoscopy and cystoscopy. The lidocaine in this spray is a local anesthetic that works by causing temporary numbness/loss of feeling in the skin and mucous membranes. The recommended dosage and timing for this spray should be determined by a healthcare professional. If you are using this medication without a prescription, be sure to read and follow all the directions on the product package. If you have any questions, ask your pharmacist. If your doctor has prescribed this medication, use it as directed. Before applying the spray or foam to your skin, make sure the affected area is clean and dry. Apply a thin layer of the medication to the affected area of skin, usually 2 to 3 times a day or as directed. If you are using the spray, shake the canister well before using it. Hold the canister 3 to 5 inches away from the affected area and spray until wet. If the affected area is on the face, spray the medication onto your hand and then apply it to the face. Do not spray near your eyes, nose, or mouth. If you are using the foam, shake the canister well before using it. Spray the foam onto your hand and apply it to the affected area. Do not use this medication on large areas of the body, cover the area with waterproof bandages or plastic, or apply heat unless directed to do so by your doctor, as this may increase the risk of serious side effects. After using the medication, wash your hands unless you are treating an area on the hands. Avoid getting the product in your eyes, nose, or ears. If the medication gets in these areas, rinse the area immediately with clean water. The dosage of this medication is based on your medical condition and response to treatment. Do not use more of this product, use it more often, or keep using it longer than directed. If there is an infection or sore in the area to be treated, do not use this medication without consulting your doctor first. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. After using Lidocaine-Benzalkonium-Alcohol aerosol spray, you may experience temporary redness, stinging, and slight swelling at the application site. If these effects persist or worsen, it's important to contact your doctor immediately. If your doctor has prescribed this medication for you, it means that they have determined the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, seek medical help right away if you experience any of the following very serious side effects: slow or shallow breathing, seizures, pale or bluish skin, unusual tiredness, shortness of breath, or fast/slow/irregular heartbeat. A very serious allergic reaction to this drug is rare, but if you notice any symptoms of a serious allergic reaction such as a new or worsening rash, itching, swelling, severe dizziness, or trouble breathing, seek immediate medical help. This is not a complete list of possible side effects, so if you experience any other effects not listed here, be sure to contact your doctor or pharmacist. Remember, always call your doctor for medical advice about side effects, and report any side effects to the appropriate health authority as needed. Before using Lidocaine-Benzalkonium-Alcohol aerosol spray, make sure to inform your doctor or pharmacist if you have any allergies to lidocaine or other similar anesthetics. Also, let them know about your medical history, especially if you have broken skin or an infection in the area where the spray will be used, or if you have heart disease, liver disease, or a certain blood disorder called methemoglobinemia. If you are going to have an MRI test, it's important to inform the testing personnel that you are using this product. Some brands of this spray may contain metals that can cause serious burns during an MRI, so it should not be used before the imaging. Before any surgery, be sure to tell your doctor or dentist about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. It's also important to note that children may be more sensitive to the side effects of this medication. If you are pregnant, this spray should only be used when clearly needed, so it's best to discuss the risks and benefits with your doctor. And if you are breastfeeding, consult your doctor before using this medication. When using Lidocaine-Benzalkonium-Alcohol aerosol spray, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial to consult with your doctor before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of Lidocaine-Benzalkonium-Alcohol aerosol, spray. If this medicine is inhaled or swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include drowsiness, irregular heartbeat, and seizures. Be sure to keep this in mind and take necessary precautions when using Lidocaine-Benzalkonium-Alcohol aerosol, spray. It is important to use this medication regularly to get the most benefit from it. Follow your doctor's instructions carefully. Do not increase your dose or use this drug more often or for longer than prescribed. Too much lidocaine in your body can be dangerous. Use this medication regularly to get the most benefit from it. To help you remember, use it at the same times each day. If you are using this medication on a regular schedule and miss a dose, use it as soon as you remember. If it is near the time of the next dose, skip the missed dose. Use your next dose at the regular time. Do not double the dose to catch up. If you use this spray regularly and happen to miss a dose, use it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and use the next dose at the usual time. Don't take a double dose to make up for the missed one. When using Lidocaine-Benzalkonium-Alcohol aerosol, spray, it is important to store it at room temperature and avoid freezing. Keep it away from children and pets. Do not store the spray canisters near high heat or open flame, and do not puncture or burn the container as it is under pressure. It is important not to flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.